before I started this program, I worked inpatient nursing and did neuro, wasn't pandemic hit, wasn't making any big career moves at the time. Knew I wasn't totally in love with where I was at and didn't find it to be fulfilling. I think I mentioned this in my essay when I applied to the program, that I always just wanted to do more, and it, was always met with that's out of my scope, or that's not my job, or yada yada, things that I could do more for the patient once they left the hospital. I've been about a year into the program now, and I've since moved to New Orleans, and I work in an emergency room in a level 1 trauma center. We meet all sorts of kinds of patients there that could really use the information that we're learning during our forensic program. I get forensic patients in all the time. We actually have in our emergency department a full-time forensic staff, which is very rare. Usually they're kind of contracted out and they have to, they cover a whole bunch of hospitals, and wherever they get called in, and it can be a wait, it can take forever. Sometimes there's not even anyone available. There's too many calls. So it's been amazing that I get to do my job as a full-time ED nurse and also work with the forensic staff there. They get to, because of what I am learning in school, usually with a forensic patient, the ED nurse is pretty hands-off. The forensic nurse kind of takes over, and unless there are medical concerns, we don't do a whole lot. But because of where I'm at, I'm able to kind of double dip and help out, find more resources. I get to just be a lot more involved, and especially with the traumas that come in, what they're starting to do, what's really interesting, like if there's ballistic evidence, or if say a patient doesn't make it, we're able to help with evidence preservation and ballistic evidence handling, and get that to the authorities and the appropriate parties and who needs to have that stuff. They're starting to even follow up with patients within the hospital. And I know you, Kelly, that you have written a paper about the role of the forensic nurse hospitalist, and it seems that our ED is trying to transition to that. And I don't know if they even really realize that's what they are doing, or if they just need someone to do that job, and forensics are the only people who seem to have that sort of education, because it really is a subject that is so, and like a profession that is so needed, that there isn't really anybody out there who fits that role, unlike the forensic nurse and all the things that we get to learn through this program, which is amazing. I am very, very far away from east side of Michigan, so I do come back for our mandatory in-person session dates. Those are about once a semester, and they really do an excellent job of grouping those days together. So you come for 2-3 days of all day intensive kind of boot camps, where they have speakers, different training sessions. And for me, when I'm there, we tend to work it out with the professors that I will, if I want, I can schedule at the Ottawa County Health Department. I can, do my session there. Or if I don't want to stay an extra day or so, they work really closely with you to set up clinicals wherever you are. And just through my job, I've been able to work with them to kind of create my own schedule of where I think I would rather go, and an area that interests me more. Our emergency department provides resources for the Family Justice Center of New Orleans that I'm able to go and work with. I get to do my forensic sexual assault training that is largely incorporated into your spring semester of your second year. I don't know how that works out. I get to do mine at the ED of my choice in my own employment and work with my coworkers, which is really nice. I really don't feel, I like it because I feel like it's my own version of forensics that I get to learn. I'm not sharing all the wonderful, excellent resources with the entire cohort. It can be a bit difficult sometimes just to try and coordinate that with the entire group. But me, I have the flexibility of being the only one down here looking for resources, and the professors work extremely close with you to make sure you're meeting all the necessary criteria in a way that you're able to still work a full-time job and be with your family and have free time. It doesn't, it's not difficult at all. I thought I was a bit worried about it just being so far away and I moved somewhere where I didn't know anyone or have any connections at the time. And it's been not an issue at all. And I honestly like it because I get to explore forensics in an area of the country that maybe not a lot of people have yet, or, you know, someone the program isn't familiar with. So you get to kind of work with them and almost share opportunities that maybe they haven't heard yet too, which is really cool and only helps, you know, our entire cohort as well.